Neuroblastoma is a rare and aggressive form of cancer that primarily affects children, usually occurring in infants and young children. It originates in immature nerve cells, neuroblasts, and typically develops in the adrenal glands, which are located on top of the kidneys. However, neuroblastoma can also occur in other areas of the body where sympathetic nerve tissue is present, such as the chest, neck, and pelvis. This cancer's behavior can be highly variable, ranging from spontaneous regression or maturation to rapid and aggressive growth. Here's an in-depth look at neuroblastoma, including its treatments, prognosis, ongoing research, and support resources. Standard of care treatments for neuroblastoma surgery. Surgery is often the initial treatment for neuroblastoma. Surgeons aim to remove as much of the tumor as possible while preserving surrounding organs and tissues. Chemotherapy. Chemotherapy is a cornerstone of neuroblastoma treatment. It involves the use of powerful drugs to target and kill cancer cells. Chemotherapy is often administered both before and after surgery to shrink the tumor, eradicate any remaining cancer cells, and prevent relapse. Radiation therapy. Radiation therapy may be used to target neuroblastoma cells that cannot be removed by surgery or to treat metastatic tumors. It involves the use of high-energy radiation to destroy cancer cells. Stem cell transplant. In cases of high-risk neuroblastoma, stem cell transplant, bone marrow, or peripheral blood stem cell transplant may be performed. This treatment allows for the use of high-dose chemotherapy, which can be more effective but also more toxic to the bone marrow. Immunotherapy. Immunotherapy, specifically anti-GD2 antibody therapy, has become a promising treatment for neuroblastoma. The monoclonal antibody dinutuximab, combined with cytokines and other medications, helps the immune system recognize and attack neuroblastoma cells. Isotretinoin, 13-cis-retinoic acid. After initial treatments, patients with high-risk neuroblastoma may receive oral isotretinoin for several months. This drug aims to prevent cancer recurrence. Targeted therapies. Some targeted therapies, such as tyrosine kinase inhibitors, are being explored in clinical trials to determine their efficacy in treating neuroblastoma. Prognosis for neuroblastoma. The prognosis for neuroblastoma varies widely based on several factors, including the age of the child at diagnosis, the stage and extent of the disease, and the genetic characteristics of the tumor. Here's a general overview of the prognosis for neuroblastoma. Stage 1. Neuroblastoma confined to one area, typically the adrenal gland, with complete surgical removal, has an excellent prognosis, often resulting in a cure. The 5-year survival rate for Stage 1 neuroblastoma is often around 95% or higher. Stage 2. Localized tumors with incomplete surgical removal may have a favorable prognosis, but there's a risk of recurrence. The 5-year survival rate for Stage 2 neuroblastoma is generally favorable, with rates often exceeding 90%. Stage 3. Tumors that have spread to nearby lymph nodes but are resectable have an intermediate prognosis. The 5-year survival rate for Stage 3 neuroblastoma varies, but is typically lower than for Stages 1 and 2, often ranging from 50% to 85%. Stage 4. High-risk neuroblastoma that has spread to distant parts of the body, such as bones, bone marrow, or other organs, often has a less favorable prognosis. However, aggressive treatment approaches, including stem cell transplant and immunotherapy, have improved outcomes for some patients. The 5-year survival rate for Stage 4 neuroblastoma is typically the lowest among all stages, ranging widely from approximately 20% to 50%. Stage 4S, special. This stage is typically seen in infants with small tumors that have spread to the liver, skin, or bone marrow. Many infants with Stage 4S neuroblastoma experience spontaneous regression without aggressive treatment. Promising therapeutics for neuroblastoma. Ongoing research in neuroblastoma is exploring various promising therapeutics and treatment strategies, including immunotherapies like dinutuximab and newer immune checkpoint inhibitors are showing potential for improving outcomes in high-risk neuroblastoma. Precision medicine researchers are investigating genetic and molecular markers in neuroblastoma to identify targeted therapies tailored to individual tumors. Biological agents that target specific pathways involved in neuroblastoma growth and metastasis are under investigation. Genomic and proteomic studies. Advancements in genomics and proteomics are providing insights into the underlying mechanisms of neuroblastoma, leading to potential targeted treatments. Therapeutic plasma exchange. In 2008, scientists screened donor blood for its ability to kill a neuroblastoma cell line. 9 children with relapsed neuroblastoma received a complete exchange with the donor plasma. In 3 patients, minor tumor responses were observed. In 1 patient, stable disease was maintained for 3 years. In another child who received 10 therapy cycles, disease-free survival was maintained for 8 years without any further therapy. This was confirmed in another clinical trial. These trials and several other integrative treatments against neuroblastoma are described in the book Cancer Self-Defense 101. Quick tips to help you survive. Why neuroblastoma is tricky. Neuroblastoma is a tricky cancer for several reasons. Heterogeneity. The disease exhibits significant heterogeneity with different genetic and molecular characteristics. This makes it challenging to develop a one-size-fits-all treatment approach. Aggressiveness. High-risk neuroblastoma can be extremely aggressive, requiring intensive and multimodal therapies. Even with treatment, it can be challenging to achieve a cure. Age sensitivity. Neuroblastoma primarily affects infants and young children, and treatment approaches must consider the unique needs and tolerances of pediatric patients. Spontaneous regression. Some cases of neuroblastoma, particularly stage 4S, may spontaneously regress without treatment, complicating the decision-making process regarding intervention. Late diagnosis. Neuroblastoma may not present symptoms until it has reached an advanced stage, making early detection challenging. Support organizations and resources for Neuroblastoma Children's Oncology Group, COG. COG conducts clinical trials and research for pediatric cancers, including neuroblastoma. They provide resources for patients and families. Neuroblastoma Children's Cancer Society, NCCS. NCCS offers support and information for families dealing with neuroblastoma. Cure Search for Children's Cancer. This organization focuses on advancing research and improving outcomes for pediatric cancers, including neuroblastoma. For more information, please see the book Cancer Self-Defense 101. Quick tips to help you survive.